Today we're going to be asking Dr. Hicks some questions about kennel cough. What is kennel cough?
So kennel cough is just an umbrella term that includes multiple different upper respiratory viruses and bacteria.
Is kennel cough contagious and how does it spread?
Yes, it's very contagious, and it's spread by respiratory droplets or sneezing, coughing, things like that.
How can you prevent the kennel cough virus itself, or when you talk about the umbrella of kennel cough?
So we vaccinate for Bordetella, parainfluenza, adenovirus, and influenza. Those vaccines are available for your pets, and you really can't prevent it completely, especially if they're going to grooming facilities and boarding facilities. They're going to be exposed at some point, but the best protection for your pet is obviously to get vaccinated.
Pets who come in and they have it from, or possibly from somewhere else, even if they're not showing symptoms, can pass it, right?
Yes, they can still transmit the virus or the bacteria for up to a month, sometimes after resolution of signs. So like if they were coughing or sneezing, you definitely don't want to go anywhere in the public for at least 3 weeks to a month after that.
What are common things that people might mistake for kennel cough that could be a bigger issue that you would still recommend them come in for if they're having like those symptoms?
So if you have a dog that's coughing, that's a little bit older, and it might not be an older dog either, it could always be like a heart murmur. So it's important to have the doctor listen to the patient's heart and lungs to rule out like pneumonia and things like that too. It could also be like something like tracheal collapse, which is common in small little older dogs as well. So if they're coughing, you should probably get a vet to check your pet out.
Better safe than sorry. All right, how long should you quarantine after a pet has been diagnosed with kennel cough?
I would say 3 to 5 weeks after resolution of signs. So once they've stopped coughing or sneezing, you wait 3 weeks before you go anywhere.
And say it has stopped and then they start again.
Another 3 weeks after that.
You restart, guys. You restart.
Mhm.
And then in regards to common symptoms, we already went over coughing.
Coughing, sneezing, nasal discharge, ocular discharge, lethargy, not wanting to eat or drink, things like that. Now, most of the time, this could, if it's just a virus, then it'll be self-limiting, which means that the pet can fight it off themselves eventually. But if it's a bacteria like Bordetella, we would need antibiotics, and most of the time we do steroids with it to help with the inflammation and the coughing. And either one, just like if a person gets the flu or something like that, it could turn into something else. So this could turn into like pneumonia or something else if it continues to get worse and it's not treated per se.
So we're not treating the virus itself, we're treating the symptoms until the virus
Right.
clears.
So you're treating the clinical signs. You're treating the pet. So